Hi there, my name is Dr. Cruz. I'm an MD physician. I've been practicing for over 30 years, and I started my career in emergency medicine. I did 10 years of emergency medicine. I was board certified twice, and then I did 2 years of anesthesia training with a focus on pain procedures, and then I shifted gears again and focused on integrative medicine, and that's what I've been doing for the last 20 years. Integrative medicine blends the best of modern medicine and natural or complementary medicine. And now my focus is on wellness and prevention and treating chronic challenging problems that often modern medicine doesn't have a solution for. And this is a video information consultation, but you'll definitely have an opportunity to meet with me in person or through Zoom to ask any questions that I haven't answered. And what we're going to cover today is how we treat heart disease, vascular or blood vessel disease, atrial fibrillation, vascular disease of the brain. And we have two primary treatments to help with that. Now, many physicians, including many cardiologists, will tell you that heart disease is not reversible, or that it is reversible with extreme efforts of diet. There's a physician at the Cleveland Clinic who teaches people how to eat very healthy, and he has lowered calcium plaque scores. So a calcium plaque score is a level of plaque in the arteries in your heart, and we encourage patients who are 50 and older, or even 40 to 50, to get a heart calcium coronary artery plaque score. It's a 5-minute CAT scan of your heart, and it tells you how much calcium deposited or deposits are in the main blood vessels of your heart. It is not a perfect test. You can have calcium deposits inside the heart, and inside the blood vessels, and then you can have deposits outside the blood vessels. But a calcium score above 200 starts to bother us, and certainly above 400, we will definitely want you to see a cardiologist. The best test, if you have an elevated calcium score, is an FFR, and it is paid for by insurance. And if your score is less than 0.8, then you may need a stent. But if it's above that, you have heart disease, but it can be managed. So how do we reverse or remove the calcium plaque in the blood vessels of the brain, the heart, the legs, the arms? We do that with two principal approaches. One is IV phospholipids. IV phospholipids, also called IV Plaquex, can remove the soft plaque in arteries. And you can go to plaquex.com and see that research. IV chelation is the main method. We like to complement IV chelation, IV sodium EDTA chelation, or IV calcium EDTA chelation with IV phospholipids. So the phospholipids are taking care of the soft plaque, and the IV EDTA calcium is removing heavy metals from your body. And we all have a certain level of heavy metals. If you want to know how high your heavy metal levels are, you would want to get a urine metal challenge test, and that's where you take 4 chelation pills on a day that you're not busy in the morning. You wake up, you urinate, then you take your 4 chelation pills, and then you collect your urine for 6 hours. And then you see if you have an elevated level of lead, cadmium, arsenic, or mercury. And based on that level, we can give you an approximation of how many IV chelations you're going to need to get that back to normal. heavy metals like mercury in dental fillings and lead from all the pollution that we live in make our bodies more susceptible to cancer and to heart disease. And so when you remove those heavy metals, and it is not a rotor-rooter process, basically chelation means in Greek to grab. And so when we give you chelation into your blood vessels, the chelation begins to pull heavy metals out of your body, your bones, anywhere that they're stored, and it grabs it, and then you excrete it through the urine. And through that process, as the metals start to be removed, the endothelial, the inner lining of your blood vessels, those cells begin to repair the injured areas in your blood vessels. And it's remarkable. Typically, with anywhere from 30 to 60 treatments, we can lower a person's calcium score by anywhere from 30 to 90%. And shortly I'll show you some examples. For example, my best friend, Dr. Robert Harris, he at 45 roughly had 3-vessel heart disease. The level of blockage ranged from 75 to 99%. The widowmaker, the left anterior descending artery, was 99% blocked. He had a small heart attack at 45, and at the time, they didn't do stents; they hadn't been developed. So they did some angioplasty. They ballooned open the narrowing, and they sent him on his way. And he discovered out in California, he learned about IV chelation, and he did a lot of chelation. And he also had a problem with Wolff-Parkinson-White syndrome, which is where your heart races spontaneously. And usually he could get it under control by, holding his breath, bearing down as if he was going to have a bowel movement. But from time to time, it would get a little bit out of control. And at approximately age 65, he had an episode that he could not get his heart rate to come down. It was beating like 300 beats a minute. And so he had to go back to the hospital, the original hospital at Norton's, where he had his first heart attack. And they had a really tough time controlling his heart rate with all sorts of medicines. They were about to defibrillate or shock his heart. And finally, one of the very experienced older nurses said, well, let's try, I believe it was procainamide. And after they tried several other medicines, and they slowed down his heart rate. But naturally, they thought, you're 65, you had a serious heart attack when you were 45, we're gonna have to do a cardiac catheterization. And when they did that cardiac catheterization, all of his arteries were wide open. And the way he accomplished that was eating healthy and a lot of IV chelation and IV phospholipids. And we have the cardiac cath report. So it is unquestionable that heart disease can be reversed. And if you just simply get a stent or open heart surgery, you are fixing a major problem, but you are not reversing the process. So heart disease, blood vessel disease, carotid artery disease, the plaque keeps forming unless you do something about it. And so we treat folks who have mild heart disease but don't want it to progress. We treat patients who are so advanced that they can no longer have stents, they can no longer have open heart surgery, they have congestive heart failure, they can't walk 10 feet without getting chest pain or shortness of breath. They're at the maximum prescription medications they can tolerate, and we treat those people. And usually within 10 treatments to 20, their chest pain and shortness of breath goes away. And again, there's lots of video testimonials that can prove that. So what we like folks to do, again, is get a heart and vascular screening. You can call our office and order that prescription at no charge. We'll email it to you. And we like Clark Memorial, Norton's, but we like the outpatient center at Sellersburg because they'll give you your results. All the other hospitals hang on to the results. and they're the most efficient and the best priced. I think they're $200 for 4 tests that each used to cost more than $500. So you get a 5-minute CAT scan of your heart to look for the blockages in your heart, and you'll get a heart plaque calcium score. They do an ultrasound of your carotids. They do an ultrasound of your abdominal aorta to make sure that you don't have an aneurysm. And of course, in the carotids, they're making sure that you don't have blockage that could make you susceptible to a stroke. And then they check blood flow in your legs with something that's called an ABI index. All 4 of those tests take under an hour. It's a very, very good screening tool. Not enough family physicians are ordering it. And if you're concerned about your heart or your blood vessels, or you're concerned about a loved one and you want to get a baseline, it's a good thing to start thinking about it at around age 50. You might consider doing it earlier if you have a very strong family history of heart disease. Somebody in your family had a heart attack at 45, or you have a lot of risk factors like high blood pressure, smoking, diabetes, being overweight. If you have a lot of risk factors, then you might want to get the screening done earlier, between age 40 and age 50. But typically, we tell people to wait till they're 50. And if their calcium score is, like say 200 or less, we just tell them to repeat it every 1 to 2 years, just to be cautious. Because sometimes heart disease and blood vessel disease accelerates very quickly, and we're just not aware of it. The most I would wait is 3 years, 3-year intervals to have that test done, because it's so affordable, and it's just worth doing. So next I'm going to show you some information. Dr. Gervasio Lamas is an MD physician, a cardiologist, educated at Harvard and then Northwestern, where he did his residency. And he was tasked with hired by the government to prove that IV chelation did not work. And he did a famous TACT study, T-A-C-T. And what he proved was that IV chelation, without a doubt, works. And it's amazing, not only does it lower your calcium score and improve the circulation in your whole body, but it reduces your chances of death from all causes by over 40% if you're a diabetic, and approximately 20% if you're not a diabetic. So imagine there's really no therapy, natural or modern, that can lower your risk of death and of all other complications, stroke, heart attack, cancer, for 5 years by 20 to 40%. And in this case, diabetics are the luckiest because they get the biggest bang for their buck. We have some graphs to show you that. And most cardiologists are still very skeptical of IV chelation, but the research is unequivocal and very compelling. And on our website, we have 2 presentations of Dr. Gervasio Lamas presenting his research to the American College of Cardiology. And in spite of his excellent research with, I think, over 1,500 patients and, I think 5 or 10 years, he has still been met with a lot of opposition. So think about getting screened if you have any concerns. It's worth the money to have the peace of mind to know that there's no serious problem. And if there is a serious problem, you want to catch it early when it's easy to correct it, not after you've had a heart attack. And that's usually how I think most patients discover that they have heart disease. And there's a lot more to it. I mean, IV chelation is profoundly helpful, IV phospholipids also. But, you need to learn stress management. You need to learn how to eat better, basically give up sugar and carbohydrates and processed foods that are in a box. General rule, avoid white foods, white flour, white sugar. Eat things that are close to Mother Earth, you know, vegetables, organic, pesticide-free, from a farmer's market, meats and fish, again, you know, pesticide-free, hormone-free, no antibiotics if possible. So this is Dr. Harris's cardiac cath report, and I'm sure you can't see it very well. Well, it's on our website, and we'll give you a close-up photograph of it in a different part of the video. It says Dr. Robert Harris had a heart attack at approximately 45 years of age. He discovered that he had three vessel heart disease with blockages of 75 to 99%. He received approximately 200 IV chelations over 20 years and reversed the heart disease as proved by his report of his heart catheterization 20 years after his heart attack. And the cardiologist who did the cardiac cath, his impression is minimal epicardial coronary artery disease. And he says there's the left anterior descending artery has minimal diffuse luminal irregularities. Well, the lumen is the inside of the blood vessel, and he's saying minimal, so minor irregularities. So imagine your plumbing, there's a little bit of rust in the plumbing, so it's not perfectly smooth, but that's how he describes every major artery, minimal luminal irregularities. So basically it's minimal epicardial coronary artery disease, minimal heart disease 20 years after having a major heart attack. If you want to learn more and want to read a good book, Dr. Elmer Cranton, MD, is the author of Bypass Your Bypass, and he can give you a lot of great information on IV chelation. So this is a graph, again, two graphs, hard to see, but I'll try to point it out, and then I'll show you a close-up later. But the blue line these are patients, heart disease patients, and the blue line are the patients who got IV chelation, and the red line is the ones that didn't. And you can see that the ones that did not have a higher event rate. The y-axis is the event rate, and what are the events? Repeat heart attack, repeat stroke, repeat need for an additional stent or an open heart surgery. So folks in the blue line have way, way lower complications than folks in the red line. And the graph may not seem impressive, but it is very, very significant. And the difference between the two is that in this case, this group of patients who did IV chelation also took vitamins, and so they did a little bit better than the group over here. So the next chart I want to show you is Bill Hudson. And Bill Hudson had a calcium score of 553, and he did 30 IV chelations with us. And he retested, and his calcium score went to 15. So from 553, his calcium score was lowered to 15. So again, unequivocal proof that IV chelation and IV plaque X or phospholipids work. And I should tell you, I'm allowed to tell you this gentleman's name, Bill Hudson. He's a prominent pastor in Clarksville, and his age was 61 when he got this test. Mary Mattingly is 75, and when she had her calcium score done, it was 602, 602. And she did roughly 30 to 40 IV chelations, and her calcium score dropped to 0. So again, a very impressive outcome. And she was someone who had exertional chest pain, shortness of breath, walking short distances, and that, of course, all cleared up. So how do you get started? If you're interested, your first step is to get this testing done so you have a baseline. You can come in anytime you want and start doing IV chelation. You can come in and order the urine heavy metals test, and you don't have to see me to do that. Once those results come to us, I will review them. I will email the results to you. The testing prescription that we email to you if you want to have it done also explains your results. And once I get the official results, I will make my comments and my recommendations, and then you can come in and start treatment. So it's very easy to initiate treatment. And then you'll see me, and based on the whole picture, I'll decide about you seeing a cardiologist. We like you to see a cardiologist. We refer you to the best cardiologists that we're familiar with who believe in IV chelation. One other subject I want to touch on is statin therapy. I can prove unequivocally that statins are harmful. There are far better ways to take care of elevated cholesterol. A perfect cholesterol is 200 to 240. That gives you the lowest chances of death from all causes. And there's an excellent graph that's on our website that proves this with about 2 million patients from 164 countries. So statins kill your body's ability to make CoQ10. CoQ10 is vital for the mitochondria in your cells to make ATP or energy. And there are studies from Japan, from all over the world, proving that statins are far more harmful than helpful. They increase your chances of exactly what they are intended to stop: heart disease, heart attacks, congestive heart failure, Alzheimer's. All of those conditions go up if you use a statin. You've probably heard of people complaining of muscle pain. If they are genetically predisposed, that condition can lead to breakdown of their skeletal muscle. It's called rhabdomyolysis. So you can imagine if a statin can hurt the muscles in your legs, there's no question that it can hurt your heart muscle. And when you look at studies that Dr. Mercola and other doctors who do tons of research, if you look at when the statins first came out, 5 years later there was a big uptick in congestive heart failure and Alzheimer's. And then they came out with another one, and then another 5 years later, a big increase in congestive heart failure and Alzheimer's. So I would, there is a place for statins if your cholesterol is 300, 400, and you can't get it down with niacin or fish oil or other approaches, then you may need a low-dose statin. But it's the last approach that I would take. You need cholesterol. Cholesterol is the building block for all of the neurotransmitters in your brain and all of your hormones. So if you don't have enough cholesterol, once again, your chances of dying go way up. It's dramatic when you see the graph. And your quality of life goes down. You increase your chances of bacterial and parasitic infections. You increase your chances of heart disease if your cholesterol is too low. So And it used to be that the normal cholesterol was 200 to 240, then they keep lowering it, and now a lot of cardiologists want you to be at 150 or even less than 100. If you do that, your chances of a heart attack are sky high. And again, once you see that graph, you'll know. So I think that's going to be a wrap for the cardiology blood vessel atrial fibrillation information video session. And the next thing I want to talk about is ketamine therapy for depression and brain dysfunction. So ketamine is an anesthetic developed in the 1960s roughly to control pain and to put people to sleep so they could have surgery without remembering it and without having pain. Ketamine has been used on both humans and animals. In the 80s, roughly, it was a drug a party drug. It was abused. And it's a medication that's extremely safe when used by a professional who's been well trained in it. So of all the anesthetics that I used when I did anesthesia, I loved ketamine the most. Why? Ketamine, unlike all the other anesthetics, the gases that we give, the morphine, the fentanyl, propofol, Versed, all those can lower your blood pressure and take away your respiratory drive. Ketamine, as long as you don't give too much, takes away your pain, takes away the memory of the trauma, and literally enhances your brain. So ketamine, when you receive it, releases BDNF, brain-derived neurotrophic factor, which makes your brain cells grow and interconnect. So ketamine therapy, we call it the brain and nervous system reset. And it's extremely effective for a multitude of conditions: treatment-resistant depression, suicidal thinking, severe anxiety, OCD, bipolar disorder, multiple sclerosis, fibromyalgia, chronic pain, neuropathic pain. And we were the first to introduce ketamine to the Kentuckiana area. The national average for the effectiveness of ketamine is 75%. Ketamine therapy is far more effective than shock therapy. In fact, there's research on our website where many psychiatrists are recommending that before trying shock therapy, patients should try ketamine. It's much more affordable, much more accessible. You don't have to be hospitalized. The MRI depression treatment device, the name is escaping me right now, has a 30 to 40% success rate. It usually requires 30 to 60 treatments at $300 a treatment, and it's rarely covered by insurance. And you have to go pretty much 3 to 5 times a week for 4 to 8 weeks. Ketamine, on the other hand, you treat 6 treatments, 2 per week for 3 weeks, or once a week for 6 weeks. And the way we do things, we like to have you commit to a treatment package. The best research shows, excuse me, that 6 treatments is the best. And we sell you 7 treatments so you have a backup in case you need an extra treatment, excuse me, a few months after you finished your initial 6. The majority of patients feel better after the first or second treatment. And people who are having active suicidal thinking, that usually leaves them after just 1 treatment. So it is, bar none, the best brain antidepressant treatment, pain treatment ever developed. And it gets a bad rap. Some people say, well, it doesn't last very long. Well, it's true. Some people need maintenance ketamine therapy, and they get treatment once a month. In our clinic, the majority of patients do not end up needing maintenance treatment, and that's because when your brain is enhanced and you have all these new neuronal connections, it's the time to take all those new brain connections and program your brain. And so we teach you how to do a lot of new techniques so that you can control your stinking thinking. So we'll teach you breath work, we'll have you listen to special audios to help reprogram your brain in a healthy way, and we'll teach you coping skills. And with these newfound skills, seldom do patients need maintenance treatment. To give you an idea of the magnitude of severe patients, we had the daughter of a psychiatrist who was homeschooled because she was bullied. She had been in and out of mental health hospitals roughly 1 to 2 years of her life, that many hospitalizations. And she came to us when she was roughly 18. Her father was a psychiatrist, her mother was a social worker. She was homebound, severe social anxiety, severe depression, recurrent, and the parents were concerned that she would never emancipate and get out on her own. So she did her 6 treatments, and she was able to get a job part-time as a hostess and go to college part-time. And about a year after she finished her ketamine treatments, she decided she landed her dream job internship in Disney World, and she got really depressed, and she was very happy while she was there, but then she fell in love, and somebody broke her heart, and so once again old bad habits happened, and she cut her wrist on Disney property. So Disney doesn't have a very good tolerance for that, and they asked her to leave within 48 hours, and so back she came. So we were all very upset and very discouraged because she had been doing so well. So she came back and did, say 3 treatments, boosted herself back out, moved in with her parents, and within 3 months got her old job back, went back to college. She finished college, she got a new boyfriend. She now is a drug and alcohol counselor, and she lives independently and is doing great. We've had patients, we have a video testimonial of this gentleman, but he was an IT expert, chronically depressed, unemployed for, I think, 4 to 5 years. After he did ketamine, he was able to get employed. He's now the IT director at Clark Memorial Hospital. So people who are extremely impaired have made tremendous comebacks using ketamine. So why consider us? We were first to introduce it. I personally have a lot of experience with anxiety and depression in my youth, so I am very understanding of those situations, and I had to develop a lot of coping skills, needless to say, to get through an emergency medicine residency and an anesthesia residency and med school and all the rest. And when I was going through all that, there was no ketamine available to me. So I think I have a good understanding on not just a professional level, but a personal level. Our clinic is extremely safe. We can handle any emergency. And if you're considering other clinics, you want to know that the doctor or nurse practitioner or nurse anesthetist who's running that clinic has all the medications available. While in 10 years, we've never had any serious complications, on occasion, you'll have somebody who will have high blood pressure from ketamine, or their heart will race. And you need to have the medications that allow you to control those situations. You need oxygen, you need rescue equipment, and not all doctors and nurse practitioners and have the training to handle an emergency. Again, I told you ketamine is the safest anesthetic, but if inappropriately used, it has killed people. There are 5 paramedics in 5 different states who were trained to give ketamine in situations where they were confronted by a psychotic patient who needed sedation. And they accidentally gave too much ketamine, and 5 people died in 5 different states. So while it's the safest anesthetic ever developed, it can be dangerous, and you should not, abuse it yourself. That's another thing I wanted to tell you. While it's safe, and you can use it once a month if you have to, abusing it has led to bladder dysfunction and even dementia. Now, these are people who were partying in the 80s and 90s and were doing it, abusively high doses, they were passing out and just doing it over and over and over. And you can develop a tolerance to ketamine. So that's why, you can do the initial treatments close together, but then you have to, you want to space them apart. And you want to try the new skills that we're going to teach you, so that you become more resilient in dealing with adversity. And I quoted earlier that, nationally ketamine therapy has a 75% success rate, which is far exceeds antidepressants. The side effects from antidepressants, from messing up your libido to, gaining weight, tons of side effects, there's no comparison to how clean and effective ketamine is. You're treated in a private room. We like you to have a companion if you can, just because what you need to know about ketamine is that there's a 20% chance that you're going to hallucinate, and it can be a very intense experience. But if you have PTSD, you might 10 to 20% chance relive a past trauma. But what's beautiful about ketamine is that if you do relive that trauma and you get upset during your experience, you're getting rid of that trauma. You're purging it out of your brain so you stop recycling it. And, there's a 10 to 20% chance that you'll relive a past trauma, you'll get upset, you'll cry, but almost everybody at the end of the hour and a half is extremely relaxed and giddy, and a certain percentage of patients are actually laughing, and another percentage of patients say, I saw God, I know why I'm supposed to be here. So it's a profoundly helpful experience. The rooms that are in, like I said, are private. They're lazy boy chairs with heat and massage. We like you to listen to relaxing music. We, provide a very warm, cozy atmosphere, blankets, pet stuffed animals, and as far as getting started, it's just schedule a consultation, and we'll draw your blood work on the day that you start ketamine. In 10 years, I've had no blood work that made me not need to give ketamine. And the first session, no matter what your blood work shows me, you're not going to get into trouble with just one session. As far as success rate, in 10 years, we've only had 10 patients who did not respond favorably, and we've treated severe complex regional pain syndrome patients, severe OCD, bipolar disorder, and the 10 patients that didn't respond in 10 years literally are the patients who sat in the consult chair and told me, this isn't going to work, I've tried everything. These are patients who family forced them to come in to do the consultation. So if you don't believe that it's going to work, that's what you're going to manifest. And it's a testament to, we speak, think, and pray our world into existence. So if you say you cannot, you cannot. If you say you can, you can. And if you say something's not going to work for you, you're going to make that happen. So, what else can I tell you? Oh, the national success rate is 75%. I think our success rate is higher because we can enhance ketamine therapy with a ton of IVs, different kinds of IVs. So IV ozone with oxygen, that's oxygen O3, oxygen with 3 atoms. It's a gas. We mix it with saline and drip it in. There's zero risk of you having a gas embolus because it's pure oxygen, and the gas embolus comes from nitrogen. Ozone boosts your immune system, improves your circulation. It's a phenomenal drug. We use it injectable for pain. We can give you an IV Myers cocktail, which is loaded with B vitamins and zinc and magnesium and trace minerals and large dose of vitamin C and amino acids, glutathione, IV peroxide, IV colloidal silver. And those, the amino acids can help your brain make more neurotransmitters, but collectively, depression is not just caused by a chemical imbalance. In fact, that theory is being more and more dismissed. Depression can have a lot of environmental causes, and a lot of depression is caused by what we call subclinical infections. So if you've had a lot of infections or you have chronic fatigue, you probably want to enhance your ketamine with all these other nutritional IVs that dramatically energize your body. All those B vitamins and cofactors help your cells make ATP or energy. So when all your cells are functioning at their best, naturally your body and your brain is going to feel much, much better. And so I think our success rate is significantly higher. I would put it at 85, 95% because of the IVs, but most importantly, because we teach coping skills that are dramatic and they're very easy to learn. And if you start doing them right away, you will have a profound impact on your mental health challenges or chronic pain. And next, I'm going to give you a little tour of our office. So, and the suites that you would be in. So the office is a little dark, and I'll walk you around. This is the administrative area. This is our waiting room. And that area over there has 6 massage chairs. And I'll walk you there. And then we have a physical therapy room over there. This is the room I use to do most of my procedures and injections. It's a little bit messy. And then I'll take you to the big IV suite. This is where we do IV chelation and a lot of nutritional IVs for folks with cancer and chronic fatigue and Lyme disease. There's a bathroom there. And I'm taking you down the hall. There's a bathroom over here. And we keep going. And then this is one of the ketamine suites. So 2 comfy lazy boy chairs with massage. And we don't have any stuffed animals here. I think they're over here. You can see the dog and the giraffe, and we have oxygen. I think we've had to use oxygen maybe 5 times. So as long as people are judicious with the use of ketamine and monitor people, and you're monitored, your heart rate, your pulse, your oxygen level, blood pressure's monitored. This room, the light's not turning on. This is the other suite. This is the best chair, as you can tell. And then there's another bathroom down there. So I think that does it. I'll look forward to meeting with you in person or through Zoom.